Welcome to Healthcare Forward, where industry leaders, benefit advisors, and healthcare professionals come together and discuss the changing landscape of commercial health plans. Brought to you by Roundstone Insurance, the first group captive for health insurance, where smarter self-funding meets long-term savings. I'm Mike Schroeder, founder and president of Roundstone Insurance. And today I have a special guest. He came all the way here from Colorado to find some cold weather. Imagine that. Anyway, Steven Chavez, he's a vice president at Rightway, and he's in charge of navigation, services, and delivery. Welcome, Steven.
Thank you. Glad to be here.
So let's start off with what is care navigation?
Yeah, it's a great question. So care navigation is really aimed at helping the average person navigate through healthcare. So, when you think about when you need services, you have to try to figure out what's covered, where do I go, what type of specialist do I need. So what we try to do is remove a lot of the friction in terms of getting the person to the right type of doctor at the right time, and helping them understand, what kind of coverage they can expect, and really supporting them all throughout their healthcare journey. So most simply put, we're there to remove a lot of the friction.
I saw where Rightway talks about a personal touch along with a digital capacity. Can you share with me what that idea is all about? It's kind of a combination of both.
Yeah, that's a great question. So the way we built our model at Rightway is really trying to combine the best of a tech-enabled experience. So we pride ourselves on being human first. We put together a team of nurses, benefit specialists, social workers, pharmacists, but we've really powered that around a core technology that enables our members to get to the right person at the right time. And what we try to do is, again, really seek to understand. A lot of times members will come to us needing care, and they're not always asking the right question right out of the gates, right? So sometimes we have people coming in who say, I really need help finding a cardiologist. And after having a conversation with one of our nurses, they didn't need a cardiologist at all. This was somebody who was experiencing indigestion for the first time, thought that they were having a heart attack. So these are cases where talking with a nurse, with one of our social workers, we're able to really personalize that experience versus just being a place where you can get an answer. So we've really tried to combine our tech with our clinical expertise to really personalize that journey.
So what about the healthcare system in our country? I mean, why is this needed? I mean, Rightway exists independent of an insurance company, and you have a whole business model helping folks essentially access care. And what's causing, what's driving the need for your services?
Yeah, there's a variety of things that are really impacting that. So I'll break it down into a few different pieces. I think one of the biggest drivers to why this is becoming more and more complicated is you're seeing fewer and fewer people establish care with a PCP. So when you don't have that primary care provider, you don't have that trusted advisor who's really walking you through your journey, who understands where you've started to where you're at today, and help explain where do you need to go tomorrow. So with fewer and fewer people really leveraging a PCP, they've lost that person to help them along the way. So it's one of the things that, again, Rightway really prides itself with is we want it to be that doctor in the family, that social worker in the family, that pharmacist in the family who's guiding you along the way. So, that's problem statement number one. I think problem statement number two is you're seeing more and more health systems that are trying to keep, all utilization within their specific system. So somebody who does have a provider who maybe needs an x-ray or radiology of some sort, they're being sent, across the street to the hospital where it's very expensive. It's a little convoluted. So you're getting folks who are getting lost in these kind of contained health systems that are just really trying to keep all of the utilization in one space. And then lastly, I think one of the other things that has become really challenging for consumers is that as a lot of employers have tried to lower costs, or enrich benefits for their employees, you're seeing more and more complicated plan designs. So you're seeing the introduction of more and more tiered networks. You're seeing the introduction of direct contracts where, hey, you might be contracting with a local health system for colonoscopies or certain procedures that are really common in your base. Or in some cases, introducing other more extreme measures like RBP models. So as employers are trying to do this, it's making it more and more complicated for the average consumer to figure out, gosh, I just need to go to the doctor. Where do I go in this crazy mix of all these different options? So when you combine all of those things, it's created a space that is just becoming more and more difficult for the average consumer to navigate.
I got to believe when you're helping out these members as much as you're sharing, you're probably HR's best friend. Is that true?
Yeah, we try to be, certainly. So, our approach is not only to be very personal and high touch with a member, but also with the employer who hired us, right? So we do take the time to really listen to the HR teams, understand what their goals are. If they have a complex plan design, what were they trying to accomplish out of it? What were their goals? And in a lot of cases, really doing a lot of upfront diligence to understand what is covered, what is not, what are common questions, what are some of the things that is coming across their desk on a daily basis, and then helping them understand how to get their employees over to us. Because again, when you think about when somebody's going through an episode where, they might have an acute medical need or they have a chronic condition, they're really looking for someone they can trust. And picking up the phone and calling into a contact center, which is kind of one of the historic models for care navigation, that doesn't instill trust, right? So they're going to their HR leaders, they're going to folks like that. So what we've tried to do is really understand up front what the HR team has created for their employees. We give them tips on how to get them over to us. And in those cases where they have that person who really just wants that trusted, point of contact, what we've done in some cases is 3 ways with the HR person present, slowly start to, establish trust at Rightway, and then get that member over to us ongoing.
So you're much more than a call center.
Oh, absolutely. Yeah.
Let's talk a little bit about why that relationship is so different. Is it because you know so much more about the member, or is it the tech tools that you have available, or is it basically a combination of a bunch of different things? But, call centers have a rough name. They kind of get beat up a lot. Nobody likes calling a call center, let alone a health insurance call center.
Sure.
At Roundstone, we work really hard for our folks to answer the phones quickly and be responsive, but I do know that still at the same time people would like engaging with a care nav. Why is it so different?
Yeah, it's a great question. So the way we set up our center is we've tried to do an omni-channel approach so that people can meet us where they're at. I think there's nothing more frustrating, and I can't tell you how many calls we get a day where somebody had started by calling the traditional carrier, they're on hold for 40 minutes, they talk to a rep and get a very vague, very insurance-y answer, and that's just a bad experience. So what we've tried to do is leverage a combination of technology as well as an omni-channel approach. So if somebody wants to text with us, they can do that. If they want to chat in using our app and our technology, they can do that. It's interesting. We see a lot of younger folks calling in because they're using insurance for the first time. So what we've tried to do is create a very balanced approach in terms of offering different channels, different methods for folks to reach us so that we're not that traditional contact center.
Great.
Yeah.
A question I don't know if you've ever been presented with. We get it all the time at Roundstone. What makes a good customer? What kind of employer would be interested in what Roundstone offers by way of health insurance? How about Rightway? What kind of employer is a good Rightway customer?
That is a great question. And I think we see clients who come to us for a lot of different reasons. Some who are seeking care navigation as a means to reduce their spend. others who are seeking care navigation as a benefit to be like a competitive differentiator, to draw and retain talent. But what I look at in some of our best clients are those who are willing to stop, explain to us what they're trying to accomplish. We can help them with any goal that they're trying to accomplish. We just need them to take the time to help us understand. So we love clients who are willing to really walk us through their benefit ecosystem, some of the challenges that they're hearing from their employees, maybe historical challenges that they've had with either different care navigation companies or different services. So the better we can understand everything that's gone on with that client, the better we can be in terms of helping them meet their specific needs. So we look for those partners who are willing to kind of let us look behind the curtain, explain to us what's going on. And those are the ones that we truly delight. Those are the ones that we can really do some magic for. So that would be an ideal client in my mind.
That's an interesting feedback, and it explains to me, Roundstone has been working with Rightway for a while, several years. And, when we get the question about, what makes a good Roundstone customer, it's very much aligned with what you just say. One of the things I like to say, an employer who places a very high value on their employees, who views their employees as their greatest asset, they tend to be a client that fits very well with how Roundstone goes about its business. Yeah. And it sounds like, I can understand why we work with Rightway, because it's the same concept, which is, hey, if that employer truly cares about delivering a great experience for their employees and their families, then they're going to like Rightway. Absolutely. And they're going to want to help them out, and they're going to want to have that tool available to their customers. And so that's kind of a perfect alignment and match with what Roundstone says as well. Employers that place employees at a very high value, that's somebody that we work well with. You mentioned one of the reasons why is cost.
Yeah.
And, Rightway helps with cost. Can we chat a little bit about that? Do you have examples on how that comes about where, someone through the care navigation avoids unnecessarily spending money they wouldn't otherwise?
Yeah, I mean, this is something that happens on a daily basis. So I'll give you a couple different examples. One of the most prevalent ones is just, the average consumer doesn't really understand the price difference between one hospital, one center, or another. So just the other day, we had a member who needed an MRI. Where she was going to go was going to cost about $15,000 more than a facility that was literally 3 blocks away. So, in a lot of cases, we save a great deal of money to both the employee and the employer just by helping people find a better location to get things done. And this is a really important point because, culturally, we have this connection where we think that the higher the cost, the better the quality. And in some cases, that could be true. But in a lot of cases, when it comes to certain procedures, like any type of imaging, a variety of shoppable procedures, the location isn't going to be as important. You're still going to get the same high quality service. So by getting people to a high quality provider or location that's going to cost a considerable amount less money, that's something we do on a daily basis. So that's one example is, again, looking at those shoppable procedures. Some other examples that are very prevalent in terms of cost savings really starts to go down the path of, things like pharmaceuticals. So helping people understand what's covered, what's not covered, and from a consumer perspective, helping the employee to find a location where, you might be able to save, tens or hundreds of dollars per month. And if you think about that on an aggregate, you're saving the consumer a lot of money by getting them to a place where, hey, you can drive a couple of extra blocks and save an enormous amount on, your medication costs. So again, steerage is a big part of how we save money. But again, kind of circling back to that comment around quality, that also has a big part in ultimate cost savings. So there's always the upfront cost in terms of a procedure that's done. But when you go to a place where you might be getting lower quality care or seeing a provider that may not have as much experience with a specific procedure or condition, you're going to end up spending a lot more money in the long run trying to get the care that you need. So what we try to do is, again, look at the best location, best price, but also couple that with the providers who have the best expertise. So, for example, orthopedic surgeons, some who are good at knees may not be good at elbows. Right. So getting you to the right place makes a big, big difference in terms of overall savings.
So quality is a big part of how you navigate folks' care. One of the things I like to say about healthcare, probably the best thing about healthcare today is if you chase quality, you usually get a good, efficient cost.
Absolutely.
So if you make quality at the top of your priorities, you usually turn out pretty well. And it's encouraging to hear Rightway places quality. So it's not just that you're navigating to the lowest cost provider.
That's right.
That's not part of your game.
No, definitely not. And again, the right provider at the right time makes a big, big difference. So there are some things, again, where simple X-ray, ultrasound, location by location, the quality isn't going to vary that wildly. We have safeguards in place to ensure that there's good ratings and so forth. But when you start looking at other things like, neuro-oncology, very niche areas, that's an area where quality surpasses all other measures. You've got to make sure you're getting the right person to the best possible provider in order to treat that specific condition.
That's great.
Yeah.
Let's talk a little bit about access and just experience. Our family, my youngest daughter, who goes to school overseas, when she's home, finding a doctor that's available for the time period she's home and all that kind of, she found it to be a challenge. And then when she went to access the provider systems directly, was kind of confronting dead ends. And she did reach out to Rightway, and because we're a customer, and it was amazing the offers, the opportunities, and just the choice and selection she had that was provided by Rightway. And they gave her a list with quality and location and access. Is that a common experience for members? Is that the kind of way that Rightway is utilized?
Yeah, absolutely. And that goes back to, you asked me earlier around a personal touch. So whenever a member comes to us for the first time, there's a lot of questions that we ask up front. So not only are you seeking care, but what is the timeline you need it in? Are there any specific requirements that you need from your provider in terms of education, background, language, ethnicity? Like, what's important to you as a consumer? So we use all of those factors to really determine what are we putting in front of you. So if you need to be seen in a small window, we're calling those doctors. We're making sure that they have accessibility during that window of when you need them before we even offer them. So a big part of our model is really looking at, hey, not only what do you need, when do you need it by? And we've actually gone to great lengths in some of our more dense markets to partner with different health systems to get backdoor access to getting appointments, and you call them bat lines,
Right.
But we have some backdoor access into certain health systems where, if somebody needs to be seen in a more timely fashion, we can pick up the phone, have a conversation, and find out who's accessible in their ecosystem. This way we can get our members seen at a much, much faster rate. And what we generally see is people who come to us with that type of need are seen 30% faster than when they try to do it on their own.
Yeah, I would have say my daughter's experience was a lot more than 30%. It was like 100% faster because she was having trouble finding the care, and you guys solved it for her. Some of the things so far we've talked to, it's been all provider care.
Yeah.
But I do know you guys work with pharmacy benefits as well and help folks navigate the pharmacy benefit, and that's becoming increasingly more complex. Can you share, why is that happening, and why your services for pharmacy are becoming ever more important?
Yeah, and that's definitely, last year alone, we had over 18,000 interactions where we're helping somebody navigate their pharmacy benefits. And what we're seeing more and more of is, again, it kind of goes back to plan design. So we see folks who are really struggling to understand, is their medication covered? Which tier does it fall into? And in some cases, when you think about like infusions, hey, is this covered under my medical side? Is it covered by the PBM? So you see a lot of friction in that space with people trying to understand, geez, I just need to get my medication filled. Mm-hmm. You add on top of that, this now being in network for certain pharmacies, you're seeing even more cases where certain PBMs are having pharmacies that are no longer a network. And that creates, again, just another layer of friction. So I'll give you an example. One of our joint clients in the Roundstone population, it was a member who had cancer. She was needing to start infusions, and there was some friction in between getting the medication filled, getting the actual medication to the infusion center. So she had tried calling the insurance carrier, was very frustrated because spent a lot of time kind of lost in that ecosystem, getting bounced back to the PBM. Finally came to us. We figured out what was happening in that space, right. Got her set up. But the really sad moment about that, Mike, was this was somebody who is, very much at their wit's end. And literally when she called us, she was in tears saying, my gosh, the insurance companies just want me to die. Right. They're making this so hard. Right. And we're able to help her through that by, again, figuring out, hey, what are the areas that are getting in the way, and really navigating her through some of that.
That's interesting, because I just saw a post the other day, I think it was on LinkedIn, where someone was very, very frustrated and actually angry with the insurance company based on their experience and their need for the care. And I thought to myself when I was reading it, like, how nice would it be if they could just kind of hand that stress and problems off to somebody like Rightway and let them navigate through the process for them and get the outcome. Because more often than not, when they finally do get through to that insurance carrier, whether it's for prescription benefit or otherwise, when they get to talk common sense, it does usually work itself out. But the frustration levels and the anger by not being able to get what they wanted, it's they so much so that they went onto LinkedIn and posted all these angry comments about the insurance company. And thank goodness it wasn't Roundstone.
It's not surprising. Again, we see so many questions around prior authorization and just kind of the frustration of navigating through that for pharmaceuticals, and even things as simple as like, oh my gosh, it's covered, but I still have to pay several $100s out of pocket. What can you do to help? And in those cases, what Rightway does is first ensure that they're getting the right level of coverage from their PBM, but then also looking at, hey, is there a manufacturer's coupon? Are there other copay assistance programs that might be available to the member? So again, these are common questions that we see every day to really help people on the pharmaceutical side get the medications that they need.
That's really great. One area that I like to see Rightway help out with is, folks change TPAs. They're a third-party administrator. Folks change their PBMs. Roundstone just changed our PBM. And what's nice, though, if you have the consistency of Rightway, you can help that navigation. So obviously, when you make changes to providers like a PBM, there's always confusion.
Absolutely.
It's a new provider. And I know from personal experience that Rightway's a big help in kind of being the consistent partner in making those choices and those navigations. As much as the PBMs try really hard, PBM Pharmacy Benefit Manager for the newbies to this podcast, stuff gets lost in the translation, and for whatever reason the prescription gets lost or whatever. So it's really, I think, one of the positives about Rightway is you guys stay consistently available and can help people with those changes.
Yeah, absolutely. And in some cases it really matters. So one example, as you were talking, that immediately came to mind is we had a member who we helped them through the process of they're on a behavioral health medication that required step therapy. Their employer, when they started with Rightway, had just switched PBMs. So we went through the process of helping them, skip some steps and stay on the medication, which they knew worked. And then interestingly enough, 2 years later, that company switched PBMs again. And that poor member had to start that process all over again. But we had information, we had all of the background in how we helped them in 2 years prior. So we were able to merge in very quickly and actually proactively. We knew the change was coming. We knew that was a member who was on a specific medication. So, right as their benefits were being announced during open enrollment, we reached out and said, hey, no, don't worry, Rightway's here for you. We're going to walk you through this.
Cool.
Yeah. So you can't do that in every circumstance, but there are some that really stand out where we know, hey, this is a member that's going to go through some pretty extreme change if we're not merging in to help them out.
So you have a happy customer with that one, I would guess.
Yes. Very delighted.
Everybody's talking about it, so we have to bring it up. AI, artificial intelligence.
Yeah.
What's Rightway thinking or doing, or how do they view AI and the services you provide?
Yeah, that's a great question. So with AI, Rightway has been thinking about it for several years now. And the approach that we've taken is we still want to be a human first interaction. There's nothing worse than when you're really frustrated, going through a difficult time, getting a bot that doesn't even give you options to select the problem that you're actually experiencing. So while we want to maintain this human first approach, we also realize that if we're not investing in AI, we will be left behind. So what we've done is really start to empower the humans who are having the interaction. So in ways that we've done that, we're leveraging AI today to take in, synthesize, and look at, benefit plan information, pulling in clinical policies from different carriers. What this allows us to do is really start to understand, hey, certain procedures may require prior authorization. They may need certain requirements. So we can find that out a lot faster than we did in the past using AI. Some other things that we're using it for is really to stratify and help us better understand what might be going on with certain members. So what do I mean by that? We can use AI to really look at, hey, Mike's medical history, your ticket request with us, so that if we see, hey, you have a history of a certain condition, and now all of a sudden we're seeing more utilization of, telemedicine, things like that, there might be an event that's going on. And what that does is create some internal triggers so that our nurses and our other clinical staff might pay a bit more attention to say, hey, I should do an outreach and see what's going on with Mike.
And do you do that on an individual basis, or do you ever look at how the population for a particular employer is doing, like as an example, like diabetes? Or are you looking at this as AI is helping you with a member-by-member outreach?
It's doing both, actually. So what we've layered in is AI to really assist our folks who are working with members on a day-to-day basis. So by pulling in information, putting a story together so that, hey, when we have the request in front of us, we're also having some back-end intelligence tell us a lot more about what might be going on with you. So that's happening at the individual level to improve your experience as a member. But on a more macro level, one of the things that we're doing to really benefit the employer and our clients is starting to understand changes, things that might be going on within their consumer base, within their employee base. So what I mean by that is, like, for example, we have a client here in the kind of the Midwest who, through some analysis, we're able to see that they have a very, very low utilization of PCPs. They have high spend in terms of oncology, cancer treatment. And what we notice through leveraging technology is that a lot of the folks who are being treated for cancer, they're coming in very, very late stage. So this is if you combine these elements, you have a group that doesn't have PCPs, very high spend in terms of late stage cancer. Hey, by introducing some outreach, we can get them established with PCPs, get them doing their regular screenings. And that's a way where we can help save money, but also more importantly, help some of these members in their healthcare journey. Like you don't want to catch cancer at late stages. Right. So those are some ways that we are thinking about and currently leveraging AI. And just to go kind of beyond that, some of the things that we really want to see in the future from an AI perspective is making things a bit easier for those who want to self-serve. So while we want to be a human-first organization, there are folks like me when I think about some of these things, it's usually later at night. I want to be able to go in, kind of interact with something myself. So later this year, we're introducing an enhancement to our member app that's going to allow folks who are going through open enrollment to either work with a health guide or they can go in, log in, and an AI agent is going to be able to compare plans for them. So Mike, you can come in and say, hey, we're in family planning mode, or I think I might need this procedure this year. Help me compare these plans. And the AI is going to compare the differences in terms of what your out-of-pocket might look like. But it'll also tell you the differences in coverages and so forth. So while it's not going to tell you what to pick, it's going to inform you on some of your better options.
That's great. We should definitely collaborate. We're doing the same AI project too to help folks compare plans. And, because those plan documents are long documents.
They are long documents.
It's not real easy to always recognize what's different.
Yeah.
And so, we have the same AI focus. So that's really, sounds like you guys are doing a lot of innovation.
Yeah.
When you sit back and you look to the future, what would you share with an employer? What would you give them a heads up about? Behind all this AI and population management resources, is there anything else you want to share with them, what you see coming down the path?
Yeah, I think there's a lot of interesting trends out there that employers should be aware of. So I'll tick through them. I think number one, we're seeing a lot of employers go down the path of, introducing different elements into their plan design. So like I mentioned earlier, direct contracts, more point solutions. So to employers who are wanting to do that, my advice to them is be very clear on what you're trying to accomplish, whether that be adding coverage, driving cost savings. How you design that mix is going to make a really big difference in terms of how well your employees can understand it and adopt it. We're certainly there to help them navigate it. But as that becomes more of a trend, it's something for employers to really stop and think about not only the cost savings and the added coverage, but what do they really want to get out of it? We're seeing more and more of an emergence in terms of employees who need behavioral health support. And a lot of them, particularly males, do not necessarily want to bring that forward and talk about it. So, every year we're seeing a notable increase in the number of folks who are coming to us who are expressing frustration around not knowing where to go for anxiety, depression. We talked a lot about medical, we talked a bit about pharmacy, but when you think about behavioral health, there's a lot of options out there. Do you go to a psychiatrist, a psychologist, a therapist? People don't know where to go, and they're in a bad state of being. So one of the advices I would give to employers is, hey, if you have a care navigation offering like Rightway, don't be afraid to encourage folks to leverage us for behavioral health needs. There's so many things we can do to help those who need, whether it be therapeutical assistance or otherwise.
I was just going to say, how would you engage with a member with mental health questions? Just answer those questions, or just encourage them to say, we are a resource to point you in the right direction for the proper care?
Yeah.
I mean, you're not providing the care yourselves.
We are not providing the care.
But you're getting them to the right place where they can get the appropriate care.
Yeah, exactly. So part of what we encourage employers, especially when we're starting to see an uptick, we'll usually reach out through our client success team to the employer to say, hey, while we will not share any personal details of who, we can say, like, hey, we're seeing an emergence of this particular need in your population. And what we always encourage the employer to do, the HR team, is let people know that we're a resource. We have social workers who are on staff. And what these folks will do is they're not going to treat you, but they are experts who can explain the difference in terms of modalities of care, different options available, or in some cases where the need is more extreme, we can actually help you facilitate getting inpatient, getting a family member inpatient. Those are some of the sadder situations, but those are definitely ones where, you know, a lot of people tend to forget that there's this whole area of behavioral health that is equally as hard to navigate.
Yeah, maybe even more so.
Yeah.
It can be really, especially if the inpatient care is needed, it can be a real challenge.
Yeah, we had a really sad situation of a member who their child was 11 years old, had previously tried to commit suicide, was demonstrating suicide ideations again. Her psychiatrist wanted her to be in an inpatient program that was 45 days long, filled out all of the paperwork, kept getting declined. So we got merged in, and one of our social workers literally worked on this for many weeks, because what we were able to eventually get done is getting the insurance carrier to approve a authorization for 1 week at a time. So this was a multi-week program.
Right.
So literally every Monday we would start the prior authorization process all over again, so that by Friday, that child can be in the treatment she needed for another week.
Great.
Yeah, these are just examples, again, from an employer perspective of, there's an emerging amount of folks who really, really need this type of care, and certainly don't shy away from sending them our way, because that's something we can certainly help with.
And the thing is one thing we know as at Roundstone is when that kind of care is neglected and mental health is not, it eventually comes out in different challenges in the medical system. Folks that having difficult times from, say, a depression point of view, they ultimately end up having other health issues that are a lot more expensive more often than that. So let's chat a little bit what I like to call war stories. And I have a favorite one I like about Rightway. And whenever someone asks me, hey, should I include Rightway in the Bywater, which is Roundstone's TPA, should I include it in the offerings? And I think we by default do that. But what I say to them is, well, let me tell you a story of why I think it's worthwhile. And the other thing too is your costs are so reasonable. I mean, where the rest of healthcare is hundreds of dollars an employee per month, you guys are down single digits. So it's like, to me, almost a no-brainer. But the story I like to tell, and I'm sure you have other ones you can share, but it was a member who, Murphy's Law, gets a test result, a lab result at 4 o'clock on a Friday. They don't understand the test result, and their mind races to the worst possible outcome.
Yeah.
And so you can imagine the nerves, and they're basically realizing, I'm going to have to wait till Monday to find out what this means if with my provider, because it's just they're not available.
Yeah.
And they did fortunately remember, hey, I have this Rightway resource, and I can reach out to them, and maybe they can help me. And they, sure enough, were able to provide her with an answer that alleviated her concerns and basically get her in contact with the provider and the information necessary for her to realize that it was really a normal test and nothing was unusual about it and her concerns. So that peace of mind for that member was worth every penny that Rightway charged.
Yeah.
And that's the story. I just tell folks from HR, I tell owners of businesses, it's just a wonderful resource for your employees. And, we also think it'll save you some money in the long term. So you have a favorite war story you want to share that you like?
Yeah. I mean, there's so many that come to mind. But there's a really interesting scenario of kind of that illustrates clinical impact. We had a member who reached out actually asking for a dentist. So older member, lived alone, thought she was experiencing tooth pain, so wanted to see a dentist. One of our nurses merged in, started asking some questions, and while triaging the member, it was really clear that what the symptoms were suggesting was not tooth pain, but actually a neurological concern. So the nurse had really persuaded the member. It's like, hey, you really should go to the hospital. Like, this sounds like you might be having a stroke. After a little bit of persuasion, the member called her daughter, had her daughter come pick her up. They went to the hospital, and within 5 minutes of getting to the hospital, she had a stroke. So this was a situation where, again, that clinical impact really made a difference of talking to a nurse. Had we just fulfilled her request and sent her a list of dentists, she would have got what she asked for, but that's not what she needed in that moment.
Right.
So
that's that personal touch you talk about.
Exactly. And, that's one of the few times where it was very clinically appropriate to go to the emergency room. But I was looking at some numbers the other day, and in the Roundstone bywater population, 44% of the time when people come looking for an urgent care or emergency room, we're actually sending them to a lower acuity of care, most often telemedicine. But in some cases, just getting them established with a PCP.
Right.
So, there's so many stories where our nurses were able to merge in, make a difference. But the one that really resonated was certainly, that member who would have had a stroke, home alone.
Yeah.
Her life trajectory would have been very different had she not talked to Rightway.
Boy, that statistic really jumps out at me. 44% of the time, they reaching out thinking they need to go to emergency room, which we all know is probably the most expensive place to go to, get care somewhere else that's more effective, more available, and ultimately will save that person and the employer money.
Yeah.
44% of the time.
44% of the time.
Wow. I mean,
yeah. And you get a spectrum here, Mike. Like, what's really interesting is that there are times when people are wanting to go to the ED because it's their first time using healthcare.
Right.
You have somebody who's in their, early mid-20s who have historically had their parents helping them, and they're like, hey, I'm having an event. I have a sinus infection. I don't know where to go.
Yeah.
So they're going to the higher, cost points of care, which are actually not the best places to go for those conditions.
Yeah.
And then you get some other spectrums where folks go to Dr. Google, start typing in what they think they're feeling, and have that panic moment of, oh my gosh, something serious is happening, when it might be something as simple as indigestion.
And with AI, it's probably even worse, right?
It is actually worse. So I can't tell you, for all of the great things that AI will bring, one of the challenges that it has today is that people put in what they're feeling, and it doesn't always help diagnose what actually is going on. So people come back with these, oh my gosh, I'm having a heart attack, or, I need to go to the emergency room right now. And, having a clinician with experience merge in makes a big difference in terms of, nope, let's maybe try this other path instead of, going straight to the ED.
So you brought up age, generations, and now we give generations names, right? Millennials and the Z generation and all that kind of stuff. And does this resource or tool, does it play differently with different age folks? Like, would someone my age utilize it different than someone a younger person's age? I mean, is it pretty much, hey, everyone wants help navigating the system?
Yeah, it's a great question, and there's some trends that we're seeing that would actually probably surprise a lot of folks. So I think the stereotype would be those who are older want to call in, want to talk, but what we're seeing is our older populations are actually wanting to chat more. So they're less inclined to pick up the phone. Usually these are folks who are at different stages in their career, different levels of busy, so the ability to chat in is much more convenient. What we're seeing is the folks who tend to pick up the phone more often are actually a younger generation. So again, these are your early 20-somethings who, they might be coming off their parents' plan. They've never had a PIC insurance for the first time, so they call Rightway to say, "Hey, I don't know what I'm doing. What do I do?" Right. We had the other day, one of my health guides was telling me about an hour and a half phone call with somebody who wanted guidance on how to schedule an appointment. They've never done it. So, kind of crazy to sound like, an hour and a half conversation, but there's a lot more behind it. And what they're really looking to accomplish is understand, hey, how do they need to prepare? This is somebody who had something going on. And part of what we told them is, hey, you don't have to worry about that. We have nurses who can help you prep for the appointment. Once you do the appointment, we can follow back up with you, help you understand what happened. So as somebody who's very nervous using healthcare for the first time, but we do see across different generations, people coming to us through different mediums for different reasons. Some who are just using healthcare for the first time. When you look at other populations, your 40-somethings, these are folks who, your body's starting to truly break down, right? You're starting to experience changes and, I don't feel as good as I used to in my 30s and my 20s. And now I have to do these screenings. Why do I need a colonoscopy, right? So we do see that across the different generations, people can leverage us. They're coming to us for different reasons, whether it's chronic conditions, screenings, family planning, or, hey, just getting into the system for the first time. But what's been really nice to see is that our different modalities of reaching us has really allowed for these different populations to engage with us in a way that makes the most sense for them.
And ultimately, they get a choice whether they do it digitally or pick up the phone and talk to someone.
Yep.
It's really up to them.
The younger generation really wanting to engage from a digital chat, that type of experience. But when it comes to healthcare, we're seeing the exact opposite, which is just fascinating.
So that's really interesting. So healthcare, they want to talk to someone. But when they want to date, they go online. Yeah, think about that.
Yeah, isn't it crazy?
We were the exact opposite. When we wanted to meet someone, we'd go to a bar and talk to them. And, so, the younger generation flips it on its head, So, well, how about industries? Do one particular industry like these tools more than another? Like, let's say a trucking company compared to an accounting firm, or you really don't see any difference by industry?
Yeah, I think what we notice most by industry is how quickly they adopt. So when you have tech companies who have an employee base who's behind a computer the majority of the day, you tend to see much faster adoption in those populations because they get emails, they might be a little bit more app savvy. So those are folks who tend to adopt faster. Where we see in industries that adopt a little bit slower is usually manufacturing, warehouse and distribution, and then also agricultural. So on the agricultural front, you have a very dispersed population, and trying to get them to understand their benefits and knowing what they have is a little bit harder. Okay. So part of what we try to do is, how we outreach to members in terms of promoting our services. We have a wide range of ways that we do that. So not only kind of the standard email, hey, here's your offering, but also mailers, awareness phone calls, things of that nature, to reach some of those industries that are a bit harder to get to. But yeah, you do see a bit of a lower utilization, particularly on the agricultural front, just because, again, it's very hard to, if you have a population that's working across a bunch of different farms, getting them together to really understand the benefits that are being offered to them.
Right.
So that would be on the rougher side.
Steven, anything we haven't talked about you want to bring up, or do you have any questions for me? Anything I can share with you about what's going on with Roundstone, or anything that you want to ask about? Why I live in a place where the snow's falling behind me, anything like that?
Yeah, I guess, you had asked me, what advice or comments I would have for employers. I think I'd love to hear the same for you. What are you seeing from where you sit in the healthcare industry, and what are some of the trends that are on the rise from your point of view?
Yeah, I think what I would tell an employer is to get involved. Health insurance is a number 2 expense, and it's going up dramatically.
Yeah.
And the choice to ignore it, or the choice to just continue to be blind or participate in a very opaque system, I just don't think it's wise, and quite frankly, I don't think it's possible anymore.
Yeah.
The average cost per employee nowadays is almost $17,000 a year, and there are tools out there, and there's insurance programs like Roundstone, there's resources like Rightway, where you can improve what the employees experience, both from a quality and cost point of view. So, the first thing I tell an employer is get involved. Do not be afraid. It is possible to do better. It is we can do better. So that's the first thing I tell them. The other thing I would tell them is the amount of innovation and the amount of what you thought was the case from 10 years ago is completely changed today. And we've talked a lot about it today in our conversation. You brought up the whole calling versus texting, or that kind of thing. So everything is changing, and I would tell them to take another look. So if you think you have an opinion, say for example about self-funding, well, a lot has changed from what the self-funding market was 10 years ago. It's a lot different today. It's much more amenable and much more easy turnkey for an employer, say with 100 employees. So I would tell them things have changed and take another look. And then the last thing I would say is, much like you do almost any other business partner you have, really spend some time and talk about what your partner's objective is. Yeah. We both have organizations who really are trying to help the member employees, trying to help the employers. What we say here at Roundstone is we're employer first. And we try to make decisions that have outcomes that we can stand behind with our employers. So I think the employer market needs to take a step back and look at who their business partners are when it comes to health insurance. And if they're not aligned with them, if they don't share their objective of quality and an efficient delivery of that health plan, they should really consider making a change. Because I just see, and I say this because I see so much waste.
Yeah.
Hundreds of thousands of dollars that occur because they're working with a partner who is not aligned. The employer's objectives is not a priority for that partner. And so I would tell the employers, lastly, that go out there and make sure you're working with folks that are rowing in the same direction you are and who are aligned with what you're trying to accomplish. You said it. You love it when you're brought in and you get to partner up with that employer for the outcomes they're trying to get. Yeah. Rightway is a great partner because of that. And Roundstone's the same way. And I think employers could do better by finding more folks like Roundstone and Rightway, or just come to us.
Yeah, I couldn't agree more. And you touched on something really interesting in terms of aligning your objectives with the right partners. It's interesting how many employers we talk to when we're learning about their objectives, what they're trying to accomplish, and they were taken down a path of, hey, you can save money through making, adding layers to utilization management. So you're making that access to care harder, right, which is actually in conflict with your desire of being an employer of choice, being a top employer. So you have two things that are in conflict when, hey, you can still treat your employees really well, still get lower costs through smart steerage,
Right.
through, better intervention, getting people to the right place, right time. So very interesting that you said that. It's just something we see very often where sometimes our employers, some of our clients, some of their partners aren't quite matched up with some of their objectives.
Right. Right.
Yeah.
Makes common sense.
Yeah.
Well, listen, I've enjoyed our conversation today, and we really appreciate and value our partnership with Rightway here at Roundstone. And thanks for traveling to visit us and have
Yeah.
a nice conversation.
Yeah, likewise. Thank you.